Good day. We're Group G, and in this video we'll be presenting both a general examination and an abdominal examination. Thank you for your time.
Hello, Crystal.
Hello.
My name is Matthew. I'll be your doctor today. Please have a seat on the bed for me.
Thank you.
Okay, I'm just going to do a quick general examination. Now, the first thing I'm going to do is just want to check your eyes. So can you look up for me, please? Right. Okay, the conjunctiva looks good. It's not pale, so there's no signs of anemia. Okay, just keep your eyes normal for me, please. The sclera is not yellow, so I don't see any signs of jaundice at the moment. And now I can really see by looking at your lips also that it's not blue or anything, there's no blueness around it. So there's no peripheral cyanosis at the moment. But can you do me a favor, just open your mouth please and just stick out your tongue. Okay. Your tongue, there's no signs of any blueness around your tongue also, so there's no signs of central cyanosis. So what I'm going to do now is I'm going to look at your arm please. Skin color of your arm looks okay. No signs of jaundice, eyes would be yellow. Hands look okay. Palm of your hand. Palm of your hand looks good. It's not red, it's not too white, it's not pale, so no anemia. Your fingers are good, it's not blue or anything, so again no signs of peripheral cyanosis. And no sign of jaundice because it's not yellow. Looking at your fingernails, I can see that your fingernails are looking good. It's not white, so no signs of anemia again. It's not spoon-shaped, so there's no chorioneck here. So no signs of iron deficiency. So again, no signs of anemia. If I look at it very closely, I don't see any lines that shouldn't be there. I don't see any splinter hemorrhages. So no infective endocarditis. If I look at your nails from an angle, there we go, flat. I write the angle of your nail bed to the skin. It looks good, it's not an obtuse angle. So at the moment, I'm not seeing any signs of clubbing. But, if we could just do the shamrock test quickly. That's when you pass me your other hand please. You take your fingers of a set and you put it together like this. Like this, yeah. And, okay, I see a diamond, so that's good, that means no clubbing. Can you go to the next set of fingers for me please? Diamond I see a diamond. Okay, that's very good, Christoph. There's no signs of clubbing here whatsoever that I see. So could you do me a favor and can you just lie flat in the bed for me, please? What I'm going to do now is I'm going to check for edema here by the bony part of your foot, or actually on the tibia here, which is by your shin. So what I'm going to do is I'm going to apply pressure to the bony part for 5 seconds. I'm going to let go and I'm going to look at it. And if I see that it retains shape, that's good, and there's no signs of edema. So I'm just going to do that quickly. 2, 3, 4, 5. Okay, your right leg's fine, no signs of edema there. Left leg. 2, 3, 4, 5. Left leg's also good, no signs of edema. Okay, thank you.
Check your lymph nodes to see if there's any enlargements. Okay, so this is the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior chain, posterior chain, the intermedial submental, the deep anterior chain, the ulcer, okay, supraclavicular. Okay, there doesn't seem to be any enlargement.
Hello, I'm Dr. Hinzer. For the abdominal examination, your hands need to be washed and clean and warm. And then
Matthew, will you please take off your shirt for the abdominal examination?
Okay.
You need to make sure that the bed is flat and that the patient is lying on one pillow. Also, the bladder needs to be empty and there needs to be good lighting.
Now we're going to identify the 9 regions of the abdomen. The 9 regions are divided by 2 mid-clavicular lines which go, it starts if you extend your hand from the sternal notch to the clavicular head, then it's in the middle of the clavicle and it goes right down through the abdomen. This is on both sides. Then the transverse lines are just below the ribcage is your transpyloric line, and just above the pelvis is your transtubercular line. This divides the abdomen into the right iliac fossa, where you find the appendix. This extends into the ascending colon in the right lumbar region. In your right hypochondrium, you'll find your liver. In your epigastrium, you'll find the pancreas and the stomach. In your left hypochondrium, you'll find the spleen. In your left lumbar region, you'll find the descending colon, which extends down into your left iliac fossa. In your hypogastrium, you'll find your pubic region, and this is where the bladder is, and your sigmoid colon. Then in your umbilicus, you'll find your small intestines, then above that your transverse colon and your duodenum.
I will do an examination of your abdomen inspection. Firstly, your skin looks normal. The color is the same as the rest of your upper body. Hair distribution is normal. I don't see any scars or lesions from previous surgeries. There's no striae or any distended veins around your umbilicus. Furthermore, the shape is flat and normal for a male of your age. And then both sides are symmetrical, which means there are no enlarged organs or tumors or any underlying mass.
Okay, I will be doing the second part of the inspection. So can you please breathe slowly through your mouth? Okay, there's a normal epigastric pulsation of the abdominal aorta. So can you please also cough for me? Okay, so there are no abdominal protrusions, which would be a sign of a hernia, so it doesn't look like you have any hernias. And then there's also no visible peristalsis, which indicates that you have normal bowel movement.
So I'm going to be doing the auscultation of the abdominal area, and when we auscultate the abdominal area, we're going to do it in all 4 quadrants of the abdomen. And to find these 4 quadrants, we're going to draw a vertical line from the xiphoid process, and we're going to draw the line down vertically through the umbilicus. Then we're going to draw a horizontal line just above the umbilicus across the abdomen. And this separates it into 4 quadrants: the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. So now I'm just going to listen and see if we can find any peristaltic movement. So starting in the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. Okay, so within all 4 quadrants, I could hear peristaltic movement within the normal time intervals, which shows that there's normal peristaltic movement in the abdomen.
When I first find my pelvis point, it's from diagonally right from your umbilicus on top of your iliac fossa. And I'm going to start with your right lower quadrant. I'm going to start from your iliac fossa, going up your ascending colon to your patellar flex, across your transverse colon, to your splenic flex, down your descending colon, to your sigmoid colon, your suprapubic region, to your umbilical region, to your epigastric region. Seems like you have no pain.
Hello Matthew, I just want to palpate your liver if that's alright with you.
Yes, that's fine.
So the first thing I'm going to do is look for your rectus abdominalis, which is the muscle just right here. And then the next thing is on your midclavicular line, which is directly between your suprasternal notch and your clavicle head, just vertically down, there's a line. So I'm going to start in the right iliac fossa right there, parallel to the right costal margin. And it's very important that you breathe deeply for me, so preferably in through your mouth. And if you can breathe deeply for me so I can palpate, please. And again. And again. Right, I can just feel the edge of your liver. It doesn't seem enlarged, it seems completely regular, and it doesn't seem like it's tender, so it's fine.
Thank you very much.
Today I'll be palpating for your spleen. I'm going to start at the right iliac region, and then I'm going to move through your umbilical region and up to your left hypochondriac region. Normally I'm not supposed to feel your spleen, so don't be alarmed if I don't feel anything actually. I'm going to put my left hand just to support your lower ribcage. Can you please take a deep breath for me? Okay, you seem to be absolutely fine. I can't feel your spleen. Same here.
I will percuss the liver today. In order to percuss the liver, I need to percuss on the midclavicular line. The midclavicular line sits between the sternum notch and the clavicular head, and it runs down here. I will start at the second intercostal space. In order to get that, you need to start from this the suprasternal notch and find the lower angle, and the second intercostal space is in that area. So I will start percussing. Normally, the upper resonant, down. So this is the upper part of the liver, the upper border of the liver, and then I'll start at the right great fossa. Resonant, 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 down. So the liver span is about 6 centimeters, and that's normal in a patient like this.